Good morning, everyone. This morning, it's an honor to present Dr. Piet Swanepoel. Dr. Piet Swanepoel is a pathologist at Ampath Laboratories with qualifications including an MBChB at University of the Free State, as well as his FCPath in anatomical pathology from the College of Medicine and a MMedSci in Cytopathology from Stellenbosch University. His academic interests include breast and gynaecological pathology, F&A cytopathology, and digital pathology. He currently holds the position of the Regional Managing Pathologist at Ampath Northern Business Unit. Outside of work, Dr. Piet Swanepoel is a passionate fisherman, avid golfer, violinist, dog lover, and a red wine enthusiast. He is a devoted husband and the father of 2 teenagers who values quality time with his family. Thank you so much, Piet, for presenting to us. And Peter's going to talk to us about digital pathology and artificial intelligence, the ethical considerations around it.
I forgot one thing. He's a very patient human being. If you can fish, you can be patient, isn't it? Yeah. I need some of that. So the first thing I'm going to say is thank you very much for the invite. This is I feel like a bit of an outsider. This is the discussion forum, I believe. I've been here once, and I like what you guys are doing. Thank you for the invite. Great to be associated with this. So I do management these days, but I am at heart, I'm a facilities pathologist, still my first love. Must admit, I like the fishing more these days, but as I say, you grow older, you get your priorities right. Anyway, so I'm going to talk to you about digital pathology and AI. There are quite a lot of overlaps there. You can't obviously apply any AI if you don't have digitized data. Let me just advance the slide quickly. I do have a disclaimer slide, and hope you can see it clearly. This is my daughter's choir last year. They won the second prize in the national competition. Very good choir. You'll see I'm the daddy violinist standing on the side. They needed a violinist to do accompaniment for one of the pieces. So I asked the teachers who will play the violin for this piece, and I put my hand up, knowing very well that it's a very big school, so there are better violinists amongst the parents, I'm sure, and the teachers. But anyway, that's how I ended up there, and it's exactly the way I ended up in digital pathology. My acknowledgement is that there are better histopathologists in Ampath, much better. But I took on the digital pathology journey in about 2016. It's been a very long journey, but an exceptionally interesting one. We are at the point now where we've got 2 big scanners in our histopathology departments, and we have ordered 2 more. So we are really quickly going in the direction of digitizing some of our work. It will always be some kind of hybrid solution. But I mean, the advantages of having a digitized platform is actually tremendous. So I will explain this to you in a little bit more detail as I go along, because I think most people don't really understand what digital pathology is all about. So we anticipate that this is what the future is going to look like, and all kinds of robots and cyborgs and things. And I basically think that the truth is more on the right-hand side of all the data. We're going to have a tremendous amount of data that we have to work through. And I think if you are not already digitized in some way or form, your clinical notes or electronic health records and so on, I think it's now the time to start doing that. And at Ampath, we are most certainly moving very strongly and fast in that direction. My first exposure to, you can call it machine learning AI, is using the Dragon software. I don't know if any of you use it for dictation and report creation. It has changed my life completely. So I started using Dragon in 2018, and I use it until fairly recently. I'll get to the reason why I changed, but it's a wonderful thing. And there's the dedicated medical versions. The medical one is now the enterprise version that is now available everywhere. It's not cheap, but it's exceptionally good. But it does make mistakes. So I'm going to show you a couple of examples. So something I dictated, a peritoneal biopsy taken from a 65-year-old woman with a den of carcinoma in the rectum. So there's no such thing. It's supposed to be adenocarcinoma. So you can't fully trust what it says. To understand there is some entertainment value in this as well, so I'll get to that. Placenta received for histology on a 32-year-old prima gravida presenting with fecal distress. So we know that's supposed to be fetal distress, but for the life of me, I couldn't train Dragon to hear fetal distress. Whereas if you dictate now ChatGPT, it will put everything in context and it will understand, there's no fecal distress in the scenario of a placenta, and it will do the right thing. Sections show a pleomorphic spindle cell tumor with large area showing nice roses. That's supposed to be necrosis. If you don't check your report, your reputation will go down the gutter very quickly with the use of technology. So gallbladder section showing evidence of fibrosis and old inflammation. That was supposed to be old inflammation. So I'm just trying to show you, these are real life examples. I've got plenty more. Some of them are actually quite bizarre and very funny. So nowadays, we use AI quite a lot. ChatGPT for me is still the one that I gravitate towards. I don't know, maybe the first one, but there are lots of them out there anymore about these days, from Grok to Gemini, all these things. I don't even know all them. Well, the names. ChatGPT is something I literally use on a daily basis, and I use it for funny things. So let's say there's a business case, in my new world of management, there's a business case. You can anonymize your argument so it doesn't come back to who you are, and give it the facts and say, well, ask you difficult questions. So you're prepared for the difficult questions whenever you have to prepare a business case. But I use it for many other things. So I'm going to show you one example. I always see ChatGPT or AI as a beautiful young, very intelligent woman. I mean, knowing so much, it must be female. That's the way I look at it. So I asked a question, I know it's very small, that I said, all right, so give me a 10-day travel itinerary of South Africa. And it did all the appropriate things. So it said, Cape Town, Cape Winelands, go and buy some wine, go to Stellenbosch, more wine fellowship, get some wine. Adam Harness, there's some wine. And this is where I thought maybe it's starting to check my search history, but it's fun because it also gets to know you. And then it says, go to the Garden route, Tsitsikamma, Kruger Park, and come back to Joburg, go to the Ampath Museum. And so I think it's a very, very good itinerary for somebody, let's say a German or a Dutch person. I think it's an excellent itinerary, but it says nothing about Loftus. So the question is, how much faith do you really put into the result? I think you can put a lot of confidence in the result. Is it 100%? No. So I tested it further and I said, okay, please search the internet and suggest a picture of a daddy violinist. So I'm going back to that first picture. And it gave me this picture here. And I think you might agree with me, that's more a who's your daddy. But for the people in the room, you'll notice that, it's quite accurate, but not entirely correct. I'm a little bit older than that. So I asked ChatGPT to, well, at first I said, I always say thank you and please. You never know when it's going to turn on you. So I said, just make the photo a little bit older and slightly less athletic. And it came up with this picture here. Again, it did exactly, if you think about it, it did exactly what you asked it to do. So that's most likely a daddy, both of them. And they play the violin. So it did everything that you asked it to do. So it's a matter of, can you, how much confidence, how much trust can you put into the result. This whole thing about the difference between having confidence in something and fully trusting it. Take it back to your employees, or for you that are in the academic sector, go and look at your registrars, your students. Some of them are really brilliant. You can really, really have lots of confidence in what they do, but can you fully trust them without checking them? There's no way you're going to get. I think it will get better over time, and eventually the AI is going to say, well, do I have confidence in this human, or can I trust it? But anyway, so this is the way that I report these days, just like a sample case. And the nice thing about, or the difference between this and Dragon is that for Dragon, I have to detect every word, every paragraph, every line spacing, comma, semicolon, or whatever. So this is quite literally created by saying it's just another case of acute appendicitis. And this one incidentally had some granulomas, and there were acid-fast bacilli. So it's a case of tuberculous appendicitis in a 17-year-old female patient, and measured at 10 by 1 centimeter. So it said 10 by 1 centimeter, you immediately change it to 100 by 10 because those are the rules I gave it. It was always present in millimeters. And it creates the whole report, including the ICD-10 codes. The funny thing is sometimes it make up stuff. Like let's say the billing codes. I also dictate billing codes. If I forget, it will just give me billing code. Now, the funny thing is, if my appendices are always 3 blocks, it will give me the correct when it goes for 3 blocks. But, this one might have been 5. But without me prompting it, it gave me something, it made it up. So you have to check it, right? Very enthusiastic, but very, very accurate. So that's a little bit of my life as a histopathologist and AI reporting, those kind of things. I want to go into traditional histopathologist, show you how it's changed. So this is literally up to now, the gold standard of histology is a histopathologist with a good microscope. You look through it, the microscope, sit in the lab, sometimes in the basement of a big building like a hospital. We never get to offices with a room with a view. So I'm quite used to be treated like a mushroom. But so you sit there and you look through your slides, and most of us are mesmerized with what we find, and then we dictate our reports. Now, to having a scanner, it's a big machine. Well, they come in different sizes. But literally, the one that we've got is the P480 from 3. It's a wonderful high definition of your slides, and with it comes a whole slide management software package. It's really wonderful. So you sit with big screens. If you do we know that we are back? Yeah, it seems like it. Okay, so that's great. Now we'll be back just to show the move from what you can call analog pathology to digital pathology. It's got fantastic benefits and consultation, but I'll show examples. So the first thing that we can do is that we can put all the slides on a certain case. So let's have all the special stains in a particular tumor. This is a breast cancer. You can put it all on the same slide, on the same screen at the same time, report them all. You don't have to flip side to the other. So it's a wonderful way of seeing your case in a much better presented form. But it can also do you can have a look at your immunohistochemical stains and will assist you in the analysis. So this is again a breast cancer, COP2 stain. It will tell you, what is it, a 3+2+. I mean, these things are very important for the oncologist. It will assist you with that assessment. And the way that you can potentially use it is to confirm your diagnosis, which is great. But it gets even better. So if you have a tumor like this and you have to quantify the number of positive nuclei, so blue is negative, brown is positive. I mean, we can guess around about 50%. I don't know if you want to venture a guess, but so what we typically do, and this is literally the software that we have. You can block off a certain area that's the so-called hotspot in the tumor. Give it to the AI, the embedded AI, and it will count it to the third decimal or something like that, and it's repeatable every single time. So your prognostic data will be, I would say, of much better quality going forward. You don't have to guess. Now you can actually quantify it very, very accurately. And this is the way that we're moving in our practice as well. Just to show you now where the interfaces between AI and digital pathology, you've got a digitized image, you annotate where the tumor is. There's another breast cancer. I think it's a male breast, actually. The tumor, you can annotate, or you can delineate where the tumor is. You can give the diagnosis. Now, if you give it another slide with a similar tumor, it will pick it up. But it has to go through thousands and thousands of learning slides to see the spectrum of tumors, and then you have some kind of commercial product after that. What it typically does with the prostates, this is a prostate, will give you a heat map. So you can feed your prostate biopsies, and it will give you a heat map on probabilities of where the tumor is, and it will also suggest grading, those kind of things. So it's fantastic new development in pathology. So I'm always a little bit starstruck when I get to the conferences and I see how much it has developed in the last year or so with all the commercial products in it, but it's not cheap. Cytology is exactly the same. How cytology traditionally works is there's a primary screener, and 10% of the normals are then rescreened by a second person, and all the abnormals are checked by the second person. That's always that kind of buddy system. That's the way it should work. And these days now, the latest product, and we are investigating this as well, although this is really not cheap, is to have a scanner with proprietary software scanning the pap smears, and it will sift out all those abnormals, and you, as the human, just have to check it. So it's actually very, very accurate, and it's a tremendous time saver because much of this digitization and scanning can happen overnight. When you come in the next day, your positive cases are sitting for you, just waiting for you, and you can go through them and confirm the diagnosis and change it if you need to. And other scenarios have also changed in the era of digital pathology, at least. You'll see that I jump around between digital and AI, but I think the two are so interlinked that there's no point in separating them. This is purely digital. Other advantages of having a digital setup. There's always a consultation happening between two pathologists, the typical scenario where you've got a heavy set but very talented, intelligent man that wants to show a case to a silver fox. And now you can actually send the slides over to him in Portugal. And you digitize it, it's a real-time consultation. You just need to send him the link and you can have it provided it's awake. And then the other scenario is training. So we don't see this scenario anymore, really. Training is now on a digital platform, and you can literally share your slides anywhere in the world real time and do training. So these are all two scenarios that have changed dramatically in the last 10 years. So what is AI? I don't really know what a good definition is. As a son of pathologist, not a computer technique, but it's a field of computer science. I think that's the most important thing. It's not a pathology thing, it's computer science. And it develops the ability for machines to perceive the environment and use learning intelligence to take actions and maximize the chances of achieving some kind of goal. So the whole thing about assisted and unassisted, supervised, unsupervised machine learning, very technical. I don't want to go into that because, to be truthfully honest, I don't fully understand it. Deep learning and artificial neural networks. This is what AI is all about. It's a little bit like you're given information. It's like a child learning. Do we know what's going on in the head of a talented child? It learns something because it can resuscitate. It's not resuscitate. It can give you back the answer, or it can make its own extrapolations. But you never know really what's going on. They call it a so-called black box. It is kind of a mystery what happens within the computer, but it will give you good answers if you give you good input. The most important thing that I want to say is computer science, a lot of statistics, and AI is nothing if it's not some kind of application. And that's where a lot of ethical things come in, is in the development of applications for AI. So if you ask what ethics is, it depends on who you ask. If you ask a doctor, we know it. But what is always right and what's always wrong, that kind of thing. But if you ask the same question to a lawyer, you might be surprised how different the answer is. Think about if you take our, let's say, conventional idea of what ethics is, and you ask a soldier what his ethics are, it's two different things altogether. So, but we stick to the old traditional pillars of medical ethics, and I don't want to bore you with that: autonomy, beneficence, non-maleficence, justice. But now there's obviously another player in the room, so we have to also consider scientific ethics and computer science ethics. And they are very proud of who they are, and what they do, and they have ethical frameworks. So this is a bit of a tongue-in-cheek slide that I put in. I don't know if I look around the room here, everybody seems to be younger than me. But I used to read these books when I was young. I'm not going to ask you who it is, but it's Isaac Asimov. So this book was written, I think, in 1954, something like that. And that's where they really first started talking about the ethics involved in robotics and machines, right? And I say it's tongue-in-cheek. It might be true, but there were the 3 laws of robotics. It's not what this talk is all about, but just to show you that the whole issue of ethics in computer science, robotics, AI, come a very long way, all right? And it has developed and evolved in a wonderful, interesting way. I'll talk about this later. So just to say, the robot may not injure a human being or through inaction allow a human being to come to harm. So that's great. I hope that stays like it. The second rule is that the robot must obey the orders given to it by human beings, except if such orders would conflict with the first law. So you can already hear there's going to be a lot of if and then statements into that algorithm built in. And we actually see it in modern science fiction as well. A robot must protect its own existence as long as self-protection does not conflict with the first or second laws again, I'm just saying this and letting you, showing you that the whole world of ethics in science actually come a very, very long way, specifically in computer science. So they're very proud of their tradition of ethics. Remember, I'm talking on behalf of somebody else. I'm going to be a little bit critical. They say that in computer science, one of the ethical bases is respect for human-centered values. Now, you can immediately question to think that up to 15% of online traffic at the moment worldwide is for pornography. So, think about that. If they are succeeding in that, I don't know. But if that reflects our human values, then I think as a species we're in trouble. Then another principle is that whatever they do will always be explainable and transparent, which I don't agree, because how do you know what's going on in AI? There's an AI large language model, whatever you call it, and you have no idea how it gets these answers. So it's not really explainable and not very transparent, but okay, it's a noble ideal. Robust. Okay, so how often do you have to restart your computer? I doubt that the computer science products and so on are very robust. I think they are actually quite the opposite. Safety and security, how often do we hear about data breaches and all those kind of things? So yeah, it's again a very noble idea, but we'll obviously get there over time. And this is where the biggest ethical dilemma actually lies, is with safety and security of data. So we do have a clash of two worlds. The first is our world of medicine, which is cautious, meticulous, conservative. And then whatever we put into the market, whether it's pharma, surgical, pathology, AI, hopefully, will be through validated studies, peer-reviewed data, lots of years of good investigation, whereas the computer scientists are nimble, they prioritize speed, they use minimum viable products, and therefore you have to update all your software as regularly as you do. So it is definitely a clash of philosophies. And that is why there's growing concerns about this very topic, and there's a tremendous amount of data, a tremendous amount of literature these days available on the topic of ethics in digitized medicine and AI. So I invite you to go and read some of that. They all basically say the same, but it is definitely a big world study these days. And quite literally, the doctors and the computer scientists are sharing stages. 2 years ago, I went to a digital pathology conference in Lithuania. And for most of the talks, there was a computer scientist talking to a pathology crowd. Yeah. And there was even a session that was actually quite bizarre. They called it the odd couple, where the pathologist and the computer scientist will share and give the lecture. And as if those two worlds have merged somehow, so we should get used to the computer scientists wanting in on our disciplines, and they're doing that very successfully. So just very quickly, look at autonomy. So there's a lot of data being used in AI development, and a lot of things can go wrong from an ethical point of view. Because you must remember, we're working with large data, and with that comes primary and secondary uses. So just to give an idea, so in our lab, our primary use is to make a diagnosis. We've got the data sitting on a system. Now, if we were to, let's say, do research on it, or anything like that, it would be a secondary use. And I think the secondary uses need to be very well defined, and there should probably be a lot more patient thinking in the secondary use of data. So most people are actually unaware of the secondary uses of their data. And then the risk around having data on systems is data security. And it's a very touchy subject. I mean, some of the large medical organizations in South Africa has been hacked in recent years, and data has been spilled, and it's a bit of a mess. So, for us, especially in at EXCO and so on, our decision-making bodies, we focus a lot of time and effort and money on making our data secure. Because we are working with large data sets, AI development typically is not in-house, it's with third parties through internet use. So there's a whole lot of cybersecurity issues. And one has to be very careful how you de-identify data. So if you, for instance, provide a big data set, I don't say we don't do it, but I'm just saying that people that do provide data for AI development, you provide a whole lot of data on patients, you anonymize it as much as you can. but you provide a second data set for somebody else, and these are just one of the identifiers. You can quite easily link data sets with each other, and that's how you can re-identify data. It's very complex stuff. It is very difficult to truly de-identify data. Consent is always an issue. I'm just mentioning it as I don't have answers. Should patient consent stand in the way of scientific advance? I don't know. I think in South African setting, we are very, very careful about the use of patient data, and therefore consent is actually always required in some other form. But it does become a little bit grey, because if you use thousands of patients, millions of patients' data, it's difficult to get consent for all of them. So I'm just mentioning that for completeness. Can patients opt out? They can, but I mean, the point is that we'll probably never be able to take a patient out of our database, seeing that Dr. Devon wants to access the patient's results 10 years down the line. So if the patient says, remove my data, that's going to be a difficult ask anyway. I'm not even sure that's possible. And firewalls can help patient control. Should patients be involved in research and AI development? Same argument. I don't know if that's correct. So then there are some ethical issues around the application of AI systems, where it gets to autonomy. Should the patient be informed you're using AI for your diagnosis? That's something that you should also decide as clinicians. It's a little bit like, let's say I discuss the case with Dr. B, and Dr. B gives me an answer, or let's say a diagnosis different than mine, and I go to the patient. I mean, is there an ethical obligation for me to tell the patient Dr. B was actually involved in decision making? Maybe Dr. B is much better than I am, maybe I am much better than him. Should the patient know that I'm ignoring Dr. B's recommendations? Maybe the patient should know that, but it's all a matter of risk. So if there's some risk involved in using one or the other, or both, or to what extent, then I think you have to explain to the patient. So let's say you come up with the diagnosis, use an AI, your clinical data, and it gives you a completely different recommendation. You have to go to the patient and say, look, this is what I thought, but a very well-trained AI module on this and that suggested something else. So you must be aware that I'm actually using AI in making this particular decision, and we'll continue to monitor the outcome. But I think there must be some kind of conversation between you and the patient regarding this. All right, so let's say something about this. The interesting thing is that there is no case law in existence. That's not fully true anymore, because, all right, this talk is a year old. But there are actually, as far as I know, some HPCSA recommendations on the use of AI. Maybe you should just go and look up. There is some kind of guideline. And on that, one of my colleagues in Cape Town, Dr. J.D. Dietrich, gave a fantastic lecture the other day. It was in a webinar about the use of AI and the ethics around AI, similar kind of lecture, shorter. But he then referenced that document. So there is something in existence. Make sure you read it. So where does the legal liability lie? Well, you can't sue a machine, of course. And the accountability lies with the clinician or the pathologist, whoever who uses the AI. You must take responsibility for the outcome if you decide to use AI. In terms of beneficence, so you can use AI for some kind of benefit. So let's just look at it from a diagnostic point of view. In pathology, if you have digitized images, as I explained, you can get it to do some human tasks, and it will probably do it just as well, or maybe even better. I'm using that example of the pap smear slides that are being screened by AI again. That's taking one person out of the equation. You can actually do it overnight. There's a definite benefit, at least in time management. So if you have that, it's probably a good thing to use AI. Then you can use it to assist you in your diagnosis. I'm using that quantification thing that I showed you. And it's extremely specific and very accurate. Should you use it? I think you should be using it. Then this is an interesting one, which I will just quickly explain, is the use of AI on digitized images, for instance, to make a diagnosis of something like Lynch syndrome. So you've got a right-sided colonic cancer with a somewhat mucinous phenotype, young individual, female. You know that this is not your typical 75-year-old with a left-sided rectal cancer, so there's something wrong. So it's very typical cases of Lynch syndrome. It's about 4% of the population. It's important to make the diagnosis because it's a familial thing, genetic tumor syndrome. The rest of the family is prone for colonic cancer, also endometrial ovarian cancers, genitourinary cancers, brain cancer. So it's a good thing to know if Lynch syndrome is in your family. Now, the typical scenario now is that you make the diagnosis of that cancer, then you do the confirmatory test, and you can also do genetics to prove the diagnosis. And then the family can obviously be counseled accordingly. But now, what if the AI is able to pick up such specific morphological patterns in the colonic cancer that can actually make the diagnosis without you having to go through the genetic testing and so on? I mean, that will be a fantastic benefit. Not there yet, but I'm pretty sure it's going to go that way. Then what if the AI discover other things, like these tumor-infiltrating lymphocytes in the edge of tumors? Very difficult to quantify by human beings, very difficult to count those lymphocytes. If the AI can give you that value and prognosticate the tumor extremely accurately based on something that we can't really see with the naked eye under the microscope, then I think there's a great advantage in having this. So to summarize all of this, that I'm going to read this out. So once an AI technology has been validated and demonstrated to improve outcomes, and you've got good data to support this, it raises the question of whether it would be unethical not to apply the AI in clinical practice. And we're going to get there quite soon. I think the patients are going to start pushing us to say that you use AI in checking your facts. Is this the base standard of care that you ask AI, that kind of thing? We're going to get there. And I think eventually it will come so much more of our daily routine and our diagnostic workups that we cannot ignore it anymore. In terms of harm, again, around privacy and data security, I don't have to say this again, but this concept about the primary harm and the secondary harm, about data security. The primary harm basically is always, it's a little bit like a guy breaking into your house that has done nothing. The mere fact that he's there, that's the primary. It's like the data being spilled out in the public. Nothing is, somebody had access to your data. Nothing has happened. That's the primary harm. It's already wrong for me. But now, whatever they do with the data, that's a secondary harm. They're a bit like social stigma and insurance and all those kind of things. Same thing can happen whenever you create an AI product using large data, and the data is being badly handled. These kind of issues comes into the argument. So then the harms that are related to application of AI. What if the AI is wrong? Well, that's the whole thing. It doesn't have to be completely wrong, but just what if it's just a little bit misleading? And then you're actually putting your foot in it. That's again going back to that whole thing about confidence and trust. You should have your own opinion still. That's for me, that's important. Use the AI, the current context. I don't know what's going to happen in 20 years or 50 years or 100 years from now. But for now, you are still the doctor. Use the AI to confirm your suspicions, maybe to clean up your reports, stuff like that. It must assist you, but it must not replace you. Then it can be biased. So a couple of interesting case reports. So there was I think it was a cervical cytology triage AI software package that they used in Baltimore, but it was developed in Sweden. Two different populations altogether. It turned out to be blatantly racist. And that's the kind of thing. You should make sure that your AI is validated for your population. It's important to check it against your population, make sure that it's appropriate and not biased in any way or form. Interesting one. So if you put a computer in between you and the patient, you stand to lose distance between you and the patient. But make sure you don't allow the computer to become the third person. It should assist you. There should not be this pathological gap between you and the patient. And I see that another piece of harm, or another example of harm, is in training. People use AI all the time, to do their assignments, maybe to answer their questions, and they never learn how to learn. What about kids? I've got a 17-year-old that knows exactly how ChatGPT works. I have to check what it does is his own work and not ChatGPT's work. But they are very clever. I need to know that he has actually read the book for his English lit or whatever. He must read the book. He must not work only on the study notes that was given to him by the AI. He should actually do both. So in terms of justice, very quickly, in the application of AI, everything must always be done fairly, all the way from the development to the application. You don't have to read it. But you must always look at it through the lens of the population. I mean, it will be terrible if these wonderful products are available, but for some other reason, it's not being used on me. At the very least, you should not disadvantage marginalized groups. So the point is, don't develop AI on poor people for the application with rich people, that kind of thing. And that's just not fair. You must use it for all your patients, and there must be like a reasonable expectation you can use the application across all population groups, and it brings the bias thing back again. I've already mentioned this is again just talking about the bias in algorithms. One has to be very, it's not human, so there's no diplomacy in anything it does. One has to be very careful about how it can get biased. So the accountability, many people asked the question. I think Michelle, you asked the question last night. So who can be sued? The user of the AI will always be the one that's accountable. So there are three kind of users. There's the individual user, that's me or you. Then there are the organizational users like Ampath, whoever, Mediclinic. Then there are the authorities, the regulatory agencies. So I'm going to very quickly just say, if you are the individual using AI for anything, from ChatGPT to medical specific AIs, anything electronic health records with AI integrated, anything like that, you are still mainly responsible for the performance of that AI. So the first point, it should be based in current best practice. So if you ask the AI, so sitting here with a grade 2 invasive grade 2 breast cancer of no special type, the old ductal type, if you remember the old terminology, grade 2 estrogen positive, HER2 negative, Ki-67 10%, and it tells you that a radical mastectomy is actually clear, it's indicated, then it's not using current best practice. It should tell you it's new adjuvant chemo, radiotherapy, whatever the case is. But there are better things to do. So one has to make sure that the clinical best practice is the data that's being used for your AI. Then it must be transparent and reproducible. So I've got an issue with the transparency part of it, but the reproducibility is actually easy to explain. So if you use the AI here for your patient in Johannesburg, it must still be valid for your patient in Singapore and your patient in Belgium. So it must be universally reproducible and by more than one user. So if you use it and you use it, it should give you the same answers. Should avoid bias and disparities, since we've already spoken about that. Patient privacy must at all times be protected. And the onus is on you to make sure that you are familiar with the performance of the AI. You must understand the risks. You must be able to communicate that to either the patient or the customer. If your doctor is sending work to a lab, the lab is using AI, I think there is some communication that must take place. Very broad concepts. And then for an organization, you must treat it like an employee. So there must be SOPs, proper quality policies, procedures. You must do real-time quality management and performance management like you would do with any employee. We do the same for our managers. We do the same for our workers in the labs. And they don't want to know it, but we also do performance management and pathologists on a continuous basis. But you must know how they perform, and the same will go for AI. Then just lastly on the ethics on the regulatory agencies like SAPRA, FCPath, National Pathology Group. Now these authorities are always a little bit behind. So typically like a decade behind. People will be using AI or some other product or something, and then they will write the guidelines probably about 10 years after the fact. So it doesn't mean ethics doesn't mean regulatory compliance, and doesn't mean the other way around. You must always try to be compliant, but if you follow the good old rules of ethics, then you should be, in the clear. But don't wait for them to write guidelines, for something that you can use now that's safe. But anyway, I think this is a tough one, but we, again, on this point, I refer you back to the I would say, fairly newly published guidelines on the use of AI in clinical practice. Just a quick summary then. There are about 10 points that are important in digitized medicine and AI. Privacy and confidentiality, said quite a lot about that. Data security, kind of almost the same thing. It must be accurate and reliable. There must be no bias. And again, this is your responsibility. Informed consent, tough one, but I think at least you can have a discussion with your patient if AI was used in your decision making. There must be access and equity. Now, in the lab's case, if we had AI and we've got things that are similar to that, we apply to all our patients. The accountability. Okay, well, the accountability is not quite in this point, but this is more the ability of training. So you must not use AI so much you can't make up your own decisions. You can't train as a proper doctor. And that's also an ethical concern. Accountability, I've already spoken about, the individual, the organization, and then the broader society and regulatory bodies. So the standardization, interoperability, that's repeatability of the products must definitely be an important ethical point. And then the economic implications. So I put that last because it's almost not that important. If you take on an AI product in your decision making, are you going to offset those costs on the patient? You know, you say can you give him the bill? I don't know if that's ethical. So that's something you must, unless there are no rules around this. It's something that you have to make up your own mind. We certainly most don't do it. I mean, it's like we digitize some of our user labs. We don't give the patient a bill for that. It's just part of our expense. But it is an ethical consideration. Now, lastly, these are my two children. I love them to bits. The question is always, so is AI going to take over our lives? And I think it's a stupid question to ask. You know, it's a little bit like, well, cell phones take over our lives. You go back how many years, 30 years ago? You don't know. But we can't see our lives without cell phone. So we must embrace AI. There's no, well, what is the alternative? It's to not embrace it. I think we have to embrace AI. But I can tell you now, it's still going to be a computer. It's not going to be human. The reason I put my children in here is that my son has found 101 ways of catching the same fish. You know, it's just amazing how quickly it can adapt. And I don't think AI will ever be able to do that, you know, in real life scenarios. And my daughter, it's just the most intelligent thing I've ever seen. So she's starting to write a book, but you know, it's grade 8. You know, so how big can it be? But she's written the preface of the book. You know, that little bit in 6 languages because it's going to be an international blockbuster. But she has not done the third chapter yet. But what I'm saying is that unpredictability of humans is not embedded in AI. It's really not there, and not in the current state. So the unpredictable brilliance that you see in humans is what will give us the edge. And we will just adapt. You know, new jobs will come up, new kinds of ways of working will come up. So we must all embrace AI. That's my final word. Any questions you're welcome to ask.
Thank you so much. Yeah, I think you're right. I think people have a kind of misconception about AI. In my world, and also with what I tell my children, it's not about what really AI is about. For me, AI is just like really, because AI, number one, is not reproducible. Let's get that straight. If you take the same sentence, it write for you. You ask again, it write different. So it can't give you the same. But there's something very important about AI, especially for those who are in academic sector or those who are in lab medicine, whatever. What AI does actually, it's really remind us about past experience, what already exists around the world. So that's what AI actually gives you. AI does not give you something that does not exist. So it means tell you about your past rather than your future. And now, if you kind of start thinking life in that way, some of that means instead of you going, try to reinvent the wheel that's already been embedded, you could now start borrowing from the future. Now, if you start borrowing from future, we can change our environment. We can change the way we think because you don't need to know how organizing pneumonia looks like. a question that is there something organizing more that AI does not know? Can you think of something different that can actually make the difference? And I think for me, if you use AI like that, I think probably your world would be different because now you don't need to focus on the past. The past is already there. You can just pull it out and then you can already see, oh, this 1, 2, 3, 4, 5, when you do a research. Now out of blue, you want to say, but there's no answers for that. How can I get the next answer? And that means that's where human, because human only can think about the future. AI cannot think about the future. And that's for me how we look at it.
No, that's a great summary. I think one just have to be a little bit clear. AI, and it's not as objective as you think it is.
No, it's not.
So I can use a couple of examples. But if you go back to the previous American election, so I thought about this and I tested it just for fun. So it was like a week before the election. I asked it, give me good reasons to vote for Donald Trump. And it says I will not engage in any political, discussion. So I cannot answer this. I asked, give me good reasons to vote for Kamala Harris, and gave me 19 reasons to vote for Kamala Harris. So it's incredibly biased in some political way. It will probably give me a different answer now. But anyway, so the other things also, it sometimes tell you what you want to hear.
Exactly.
So, so I'm trying to think of an example. Yes. So I'm going to Europe next year, following the high school choir this time. I said, look, I'm going to be in Austria, and I want to travel itinerary for a week because then we're going to start the tour. But for the week before, I want to travel itinerary. And they gave me 4 different fishing spots in the Alps that I must go and check out. Now that's not normal, you know what I mean? But for me, that's kind of appropriate, and I appreciate it. But it gave me what I wanted to hear. But a good objective travel itinerary would have been, Salzburg and all those beautiful cultural things, and But you understand what I'm going with? Because I ask a lot of fishing questions, it gave me a fishing answer.
But it's all about input. What you put in, it will give you an answer. Let's AI in medicine, for instance. If I get abnormal blood result now, and I put it in abnormal full blood count, kidney function, liver function, I ask it, give me a differential diagnosis of what is wrong with this patient. I mean, that's more objective, or in the sense that it should reproduce a similar answer. It will probably say, it's DIC for sepsis or medications or things like that. So
also the more you put in,
yes, the better,
more accurate, the better. Because if you say,
yes.
okay, but this is of a female of this age, you might get a different answer.
What I would suggest in this example now is just make absolutely sure you don't give patient detail. I mean, that's where a big ethical breach will come in. If you give the patient's name, surname, ID, those kind of things.
Yes.
For instance, you take the PDF that you get from Ampath or Pathology, and you give it to ChatGPT. That for me will be wrong. If you give a screenshot of the result, to me that makes more sense because it assists you, and nobody can really criticize you on that. But also, there's another thing that I only learned recently. If you have the free for use version of ChatGPT or Copilot, whatever, you can use whatever you give it to improve itself. So you can actually reference what you gave. So if I go in there and I say Ampath this, Ampath that, Ampath that, eventually it's going to think that that's it's going to give other people answers based on data that I gave it. The first thing is don't put in data that's identifiable. That's like patient detail, financial detail, names of labs, and all those kind of things. So stay away from that. But if you go into the settings, there's actually a thing you can toggle on and off that says that you can use my information for the improvement of the product. Switch that off because then it can't use anything that you give it. But if you want to know how much you know of yourself, go into ChatGPT and just say, what do you know about me? And we'll give you an incredibly, my wife doesn't even know me as well. ChatGPT knows because I sit in ChatGPT. And it's a wide variety of things that I discussed with him. I think at the moment it thinks I'm a bit of a fishing junkie, but there's reasons for that. I'm going to Florida now to so I can do some heavy fishing. But the point is, it gets to know you so well. Just make sure you toggle that thing off. Otherwise, something will come up.
But I mean, things like medical AI, where you get programs these days where you talk to a patient and it will report the data and it will give you a brief summary of what is wrong. Then you put lab information in, it will probably give you a differential diagnosis.
But
I mean, it's the same as in up to date. If you've got difficulty with interpreting or an approach to lab, for instance, liver functions, you put in the data that you've got, and it will give you a differential of what it thinks is the probable cause of it.
So what I do, I sometimes do my report with the ChatGPT, but then what you need to do is that what we did when you subscribe, there's a different level of subscription. So you could actually link all your articles, like for example, on my ChatGPT, I need to have New England Journal of Medicine, ATS, European Journal of Medicine, and then they have subscription to that. So you obviously pay more. So it means every article that you want to be called to will be called out of there. But yes, but AI, I think, like production, we also know what we pick up with my wife was that now we like to book our flights online. And you have to be extremely smart. You need to know when you're booking a flight, and you have to be certain. You open, you must book straight. If you don't book, go back after 5 minutes later, prices are out of blue.
Yeah,
All the websites are already blocked. You're now paying more double than what you need to do. And that's so the airlines actually have done that. So sooner or later, it will become a kind of money-making scheme to kind of find that now the price is going to be 10 Rand, 100 Rand, 200 Rand, something like that. So you have to be very careful how you actually use the AI. But I think the best is to really write your notes first. You write your notes nicely, and then you put it to AI, say, okay, summarize that for me. That's how I use it. I put all my data the way I wanted them, all my results, everything, do my interpretation, then give you a nice kind of how to write it up. That's for me how I use my AI, but I would not use it to just because I can't write something that is not there. As I say, if I say, write medical history about this guy with COPD, it will tell you a lot of bullshit. Because as I say, AI cannot borrow from future.
It wants to please you.
Exactly, that's all.
It makes up stuff to please you.
Exactly, and also got hallucinations.
Yeah.
An interesting story. A friend of mine, she lives in Cape Town, so she's a doctor. She's a bit of a control freak. She loves handbags, right? So you can go onto websites and you can buy Louis Vuitton or a fancy handbag, and she bought a handbag online and it was a fake. And she said, never again. So before she buys stuff, she takes photos and she generates an AI. She's got an AI website and will tell them if it's a fake or a real one. Anyway, so she wanted to buy a watch. So she looked at a watch, but it was a Tag Heuer. And I think a new one was 80,000. She said, well, she can't afford it. She will look for a second-hand watch, pre-loved. So she went on a web. She went to Luxury Time or something like that. No? So they're a very big famous brand, or you can buy watches online. So if you want to sell watches and things like that. So she bought a watch, Tag Heuer. I think it was 40,000. But with her OCD, she's like, I wonder if this is not fake. This is a reputable company, because this boxer, what is his name? Driekus. Now he advertises for them, and it's quite a big thing. So she took a picture of the screen of the watch, put it into the AI, came back, said it's a fake.
Sure.
Then she went back to the company and said, no, they use people, but then they will look into it. And then they wanted to know, so how does it know it's fake? And it's very subtle differences.
Yeah.
And it was actually a fake. And they went back and they bought other watches from this person as well. And those were also fake.
Yeah.
So it shows you.
But remember, the patient's going to do the same with you.
Yeah.
So the patient's going to look at the way that you, work out a treatment plan while they're going to check it. That's the big danger. Patients now know a lot. Well, they think they do, but they're going to come back to you. So that,
I mean,
they always.
they can have, they've got access to their blood results. So I think, the first AI that we had in medicine was interpretation of ECGs.
Yeah.
So machines would give you a printout. It would generate the AI thing and give you a printout of what it thinks. But I mean, radiology these days, obviously, pathology. So, and patients become a lot more informed.
My question is regarding your ethics components that you said that you have to inform. It's advisable to inform the patient that you are using AI as a pathologist versus a clinician. How would you deal?
I think it's easier for us because we don't use AI at the moment. We've got something in the background that basically picks up all historical results and based on rules that we write for whatever scenario, we can give clever comments, but it's not an AI. Basically, it's a rules-based system. It's assisted commenting and so on. It's very clever. We can also use it to check demographics, whether it's correct. So you look at the demographic logging now, but versus all the previous historical logging of that patient, see the demographics are correct. But that's something else. It's more a software package than anything else. So we haven't used AI. You can use it. I mean, surely we can, but I mean, we don't have the same scenario that you will face. You will probably give ChatGPT the whole clinical thing and so on. My problem is in your scenarios, what if the AI differs from your opinion? Significantly so it has patient impact. What kind of discussion you're going to have with the patient? That's actually where this is coming into. It's like the lab is excluded from this argument for now. But my point is, well, if you sit there, what if it completely agrees with your approach? Then you're not going to tell the patient, but you're going to feel reassured. But what if what you wanted to do with the patient differs from the AI? Then you've got a dilemma. But it's exactly the same as consulting somebody else. So if you're a specialist, you ask another specialist. They say the two of them. They differ. But you're the primary treating physician. You're probably still going to follow your lead. Or not. But I mean, that's a discussion we have to have with the patient. I think this, my colleague thinks this. Maybe that's why MDTs are so powerful. You sit there and everybody gives an opinion. The consensus is the right answer. How do you explain the consensus with you and AI? I don't know.
They're right outside.
These are things that I can't explain. But it's a good ethical talk to provide.
Because I mean, it's something to consider because now if you're going to put in input parameters and things like that, at some point, you may have to disclose it to the patient that I'm using AI. I don't know. I mean,
You could put it into when you sign your copy.
you can.
But
You can.
That's what
we
I think that's a bit
then just sign it and say it comes.
Thank you. Will you please